Bismillahirrahmanirrahim. Hello everybody, so a 32-year-old woman gravida at 3 para 2 at 41 week of gestation come to the office for a routine prenatal visit. She has had no contraction, vaginal bleeding or leakage of fluid. Fetal movement is normal. The patient pregnancy has been uncomplicated and ultrasound at 18-week gestation showed normal fetal anatomy and a posterior placenta. She has no chronic medical condition and has no previous surgery. Her other pregnancy ended in vaginal delivery at term. The patient takes a daily prenatal vitamin and does not use tobacco, alcohol, or EC drug. Blood pressure is 110/80 and pulse is 80. BMI is 28 kg. Fundal height is 40 centimeter. The cervix is 1 centimeter dilated and 100% effaced. Non-stress test is reactive. The patient would like to avoid spontaneous labor rather than undergo an induction. Delaying delivery to 42-week gestation in this patient increase the risk of which of the following pregnancy-related complication: abruptio placentae, low fetal birth weight, oligohydramnios, placenta accreta, polyhydramnios, preeclampsia. So in this question, this patient came to us at 42 weeks of gestation, and the patient would like to avoid spontaneous vaginal delivery rather than undergo an induction. So delaying delivery to 42 week of gestation will increase this patient risk for which of the following pregnancy related complication. So first of all, as we already know that during age or during increased gestational age, there is a decreased placental function with age, as already written here, that during late gestational age there is decreased placental function with age, which can cause increased placental vascular resistance. Increased placental vascular resistance can cause uteroplacental insufficiency, and which can cause fetal hypoxemia. So during fetal hypoxemia, to prevent fetal hypoxemia, blood is shifted to the brain. So when the blood is shifted to the brain, there will be oligohydramnios. So here the correct option is choice C, oligohydramnios. I will write here oligohydramnios. Why oligohydramnios? Because oligohydramnios totally depend on fetal urine and renal function. Oligohydramnios. Why the choice C is the correct one? Because this patient has a late-term pregnancy which are at risk of decreased placental function due to age-related placental changes that cause increased placental vascular resistance. Progressive placental dysfunction can lead to uteroplacental insufficiency and chronic fetal hypoxemia, which cause central nervous system suppression and intrauterine fetal demise. To prevent this suppression, blood is preferentially distributed to the brain rather than peripheral tissue. This redistribution can be evidenced on ultrasound as oligohydramnios, as amniotic fluid is dependent on renal perfusion and urine production. Now come to the incorrect one. Why the choice A is the incorrect? Abruptio placentae. Because the risk factor for abruptio placenta include hypertension, cocaine use, abdominal trauma, and a prior abruptio placentae. B, low fetal birth weight. So low fetal birth weight is associated with preterm delivery. Choice D, placenta accreta. So risk factor for placenta accreta include prior cesarean delivery and prior uterine myomectomy. Choice E, polyhydramnios. Polyhydramnios is associated with congenital fetal malformation, that is esophageal atresia, encephaly, and maternal diabetes mellitus. Choice F, preeclampsia. Risk factor for preeclampsia include extreme of maternal age, for example, that is age less than 18 and age more than 40 years. Nulliparity, chronic hypertension, diabetes mellitus, and renal disease.